How much do you want to increase the Medicare levy?
There's obviously all sorts of options. You can make very small increases. If you were to increase it by a full percentage point, that raises the best part of $7.5 billion each and every year.
Out of taxpayers' pockets?
Indeed. Well, that's right.
So you put it up to 3%?
No, that'll go from 1.5. There's a 0.5 for the NDIS, so it would go effectively from 2 to 3. That's about $1,000 for a year for a family earning about $100,000 a year. Now, I know that is a significant hit. Maybe that's more than the community would be prepared to pay. Maybe we won't be able to find that much money. Maybe it's half that amount. I'll tell you what, 3.5 or 7.5 or whatever the number is, those billions of dollars flowing into the health system will mean better care for patients, but it's got to be accompanied by reform.
But there's an underlying problem here. Why should we trust you? Why should we trust you and the rest of them to say, here's an extra $7 billion or whatever it is, when you've been rapidly increasing spending for years, and the health system, as you've admitted yourself today, has been going down the toilet?
Oh, I haven't quite used those terms.
Well, no, I think we can be struggling.
No, it is struggling.
Okay, but we've been giving you all this money and it's still struggling. Why trust you now?
Well, if you want to have a discussion about spending, then I think you have to look at what are the priorities of the government. So, for instance, we hear about a budget emergency. We hear that we had to accept $70 billion worth of cuts to hospitals. So that's money directly taken away from doctors and nurses in the provision of the care that's so important to families right across our state. $70 billion. That's what Mr Abbott took away from hospitals, because apparently there's a budget emergency and we can't afford it. Well, the Commonwealth Government's spending more this year than it spent last year. It's collecting more in tax this year than it collected last year.
So are you.
This is not... Indeed.
So are you.
Yeah, but I'd say to you...
What are we getting?
But we're not cutting hospitals, though. We're not cutting hospitals. We're growing the number of patients that are being treated. What I want to do is see whether we can get the Medicare system that the feds pay for and the hospital system that we pay for in partnership with the federal government to work together much better.
So would you still run the hospitals?
Absolutely we would.
Would you get a different funding model for the hospitals?
Well, you see, we had a funding model that was 50-50. So we would pay for half and the federal government would pay for half. I think that's a fair partnership. Not everything has to be about a takeover. If you can get a better outcome by working together, why wouldn't you?
So you want to go back to a 50-50 partnership?
Absolutely. A shared partnership, 50-50. But if we need more money in the system, it's got to be matched by reform. You can't just say to people, well, you're all made of money and you can pay more.
But your
that doesn't
reform
work.
at the moment isn't getting rid of thousands of wasted public servants who are duplicated. It's in fact setting up a new level of duplication.
No, it's not duplication
and trying
at all.
to manage people better. I mean, that's your reform. Let's manage people. What do you think doctors are doing at the moment? They're trying to do that.
Well, if you talk to doctors and nurses, they'll tell you there's nothing more frustrating than someone who's not properly managed and ultimately finishes up in a very expensive hospital bed when they could be cared for much earlier, much more cheaply, and you get better outcomes.